Welcome to EyeCan, a podcast about ophthalmology through a uniquely Canadian lens with Dr. Sarana Institute and myself, Dr. Guillermo Rocha.
The EyeCan podcast has been made possible by support from MD Financial Management and Scotiabank, proud financial partners of the Canadian Ophthalmological Society and Canada's ophthalmologists.
We'll share our experiences as ophthalmologists today and tackle some of the challenges we face as healthcare providers. Are you ready, Sarana?
Let's do it, Guillermo.
Let's do it, Sarana. Welcome to the EyeCan podcast. On this episode of EyeCan, we talk with Dr. Agnes Wong, Professor of Ophthalmology, Neurology, and Psychology at the University of Toronto. Dr. Wong is an active staff ophthalmologist and senior scientist at the Hospital for Sick Children. In her career as a physician-scientist, Dr. Wong has published over 120 peer-reviewed papers in the field of ophthalmology and vision sciences and held many prestigious research grants.
Dr. Wong currently focuses on wellness and healthcare. She is currently on the faculty of the Mindfulness and Compassion Training for Health and End-of-Life Care Professionals. This program is at the Sarana Institute in Toronto. By integrating mindfulness, compassion, reflective practices, and systems thinking, her approach is to help healthcare professionals develop the vital skills needed to enhance their well-being and to improve the system. Dr. Wong has won critical acclaim for her latest book, The Art and Science of Compassion, a Primer, Reflections of a Physician-Chaplain. This book was published by Oxford University Press. Dr. Wong, welcome to the EyeCan podcast.
Hello, thank you for inviting me to be here tonight.
Just to get us all started, I know we've been hearing about this a lot lately. It's become so trendy in the past few years, but can you tell us in your own words what the definition of mindfulness is?
Well, mindfulness really has picked up in the healthcare field, as well as in the popular kind of area in the last few decades. And this technical definition of mindfulness is, there are many definitions actually, but John Kabat-Zinn, who actually brought mindfulness into the West, defined mindfulness as being present in a moment. And the presence is on purpose. And one quality is very important is being non-judgmental about our thoughts and emotions. For me personally, I think mindfulness is actually beyond that. Through the practice and through the training, we become, more familiar, or we actually explore who we are. And also, also look at our own unexamined assumptions and biases, our thought pattern, as well as how the mind works. And the fascinating thing is that the neuroscience have really shown us how it works, how it makes changes at the brain level, as well as the benefits that it brings and the mechanisms behind it.
Okay, that was great. I loved the part of your answer that said that we should be non-judgmental about our thoughts that flow through our minds. That's a very simple way for me to think about this. So I guess sort of related to this aspect of what you've been working on and practicing, can you tell us a little bit more about physician wellness and why this is so important? I mean, especially now, look at what we've been through the past few years. Tell us why physician wellness is an important practice for all physicians.
Sarana, I'm really glad that you caught, the important component of mindfulness is being non-judgmental. Because, if you notice, during practice, or if you actually just even spend some quiet time in your mind, you will notice that many times you have this internal critic that is harshly criticizing ourselves all the time. It's, oh, you're not good enough, or I don't look good enough, etc. Right? And I think this internal critic is actually one of the reasons why, physicians have so much distress and anxiety, is because of this harsh critic is nonstop kind of criticizing us all the time. And this really to an important component is having self-compassion on ourselves. If we start to notice that there's this internal critic that is constantly on all the time, we can also be self-compassionate, knowing that we don't really need to listen to it. It is just a thought in our head. So, and by that, we can be more kind to ourselves, just like we are with our friends. And I also think that self-compassion is critically important, because in terms of physician burnout, the lack of self-compassion, I think, is one of the major causes of it.
That's great. That really sets the tone for the conversation, Agnes. Now, when I met you many years ago, and you were in leadership positions at the hospital. I've known of several people who spent time with you in your lab and doing PhDs. And all of a sudden, there's this kind of change of direction. So I'm interested to know why this change of plans. Is it part of the plan, or was it something that sort of all of a sudden was triggered in your life and you decided to change directions?
Thank you, Guillermo. You mentioned that we met back in Quebec City. I think that was when the time that I was really busy with all kinds of leadership positions.
Yes.
You mentioned, being, having a, big lab at the time, as well as, becoming the chief of ophthalmology at SickKids, and also the vice chair of research at University of Toronto. And at that time, I really thought that I was living a highly satisfying, fulfilling life. And then what happened was, that was a few years ago now. While I was, managing all these duties, I have an illness that really triggered me to really rethink about, what is my life about? And then as I was kind of going through this really challenging personal situation, I began to look, to realize that all the, stress and anxiety and sufferings around me, not only about our patients, but also, our colleagues who are kind of really overwhelmed by all kinds of work demand or the expectations and, all kinds of situation. And then, of course, in addition to that, we also need to look at, how we try to juggle our lives, right? Like we all have a busy life as well as a family. And it seems like we can never please everyone because we just have so many things on our plate. And because of that, I realized that, the true happiness doesn't come from, external validation. It's actually really coming from how we look at ourselves, not so much about rearranging the external things that's outside there, but actually look inside and look at how we can be more attuned to what our needs are, how our mind is doing, how we are doing, changing the internals over the external.
Kind of like a reversing the senses. There was a looking more inside as opposed to outside. Is that what you're referring to?
Exactly. We look at inside rather than just turning our attention all the time outside.
And can you tell us more, Agnes, about the 3 A's? Achieving, acquiring, accumulating, and how do these negatively impact the profession? How are they important to wellness?
Right. I like to use the 3 A's. It's just a kind of catchy phrase, stand for achieving, acquiring, and accumulating. And then kind of go back to, if you think about medical school application, right? I just, recently I just went back to the basement and looked at my medical school application. I realized that I said, I want to be a doctor because I want to be of service. I want to help people. And then somewhere along the way, throughout medicine, somehow, it got distracted, it becomes, what is more important becomes more like having a successful practice, or in my case, being a successful scientist, getting awards and recognitions, having big houses, nice cars. So that's what I meant by achieving, acquiring, accumulating. And what I feel, or what I, after deep, reflection on this is that, while there's really nothing wrong to reap the reward of our hard work, in getting all these recognitions and achievements. But the problem then becomes when these things turn into some kind of obligation or distraction that steer us away from what is meaningful to us. And what's the purpose, why we're here to be a doctor, to be in medicine to begin with.
So in other words, not making it the end, but kind of like the means to help us enjoy other things, but not necessarily the end is what would affect us more in the long term.
Exactly. And I always, feel that, when I speak to colleagues or, residents, always try to remind them that the most important thing that brings happiness is to really remember what our purpose is, why we're here in medicine to begin with. And then when we are aligned, when we act in alignment with a purpose, then that is actually kind of like the secret ingredient for happiness, rather than get sidetracked by all these superfluous distractions.
That's very interesting. And so I'm also interested in some of your research that led to a very important question. And how does this relate to what you're saying? Why is the healthcare system plagued with so many problems? And what do you define as those problems? And what is the essence of that?
Yeah, this is a question that I have thought about a lot in the last few years. And I think that there are actually kind of three components. And for example, we start out with mindfulness, right? And many people think that, the reason why they're so burnout and there's so many problems in healthcare is because it's a personal issue, a personal problem. For example, being doctors, we are kind of in a way all professionistic, or we also suffer from imposter syndrome, thinking that, our success is just kind of like a fraud and we will be discovered, anytime, by someone. Or sometimes you could, just plainly, because of pathological altruism, when we think that, being altruistic is to be micromanaging and to be like there, to be attending to our patients 24/7, or, to kind of like control everything, right? So this is where kind of mindfulness comes in, because it helps us to really realize some of our patterns, or how some of our habits that are not really helpful. But then there's other second component also. It's not just about personal. There's also the interpersonal component. For example, in the pandemic, I think it really speaks very well. It's about the moral suffering they experience in our daily environment, right? Because of various constraints, we know what we're supposed to do or what is the right thing to do, but we cannot do what we want to do, right? With the limitations, for example, at the beginning of the pandemic, we don't even have enough PPEs, right? Yeah. So that's one example. Another example of interpersonal environment issues, like, for example, bullying, whether it is in the workplace or especially for trainees, they're actually really experiencing that a lot. And then the third component, I think, that is also very important, that is not just about a personal, interpersonal issue that can be kind of like, that can be balanced by having, a more mindfulness practice, is actually the system component. That's why system thinking is important. Just think about, the emphasis on economic rationality, right? On efficiency, on throughput, as well as, the patient volume that we deal with every day. So that's why I think, if we really want to have a holistic approach to the many problems that plague the healthcare system, it requires us to look at all three aspects: personal, interpersonal, and systemic.
Excellent.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
Hi, I'm Dr. Nupra Bakshi, and I listen to the EyeCan podcast.
So Agnes, diving a little bit deeper, you describe three scientific principles: neuroplasticity, epigenetics, and inborn goodness. Can you tell us more about this?
I did some research on this area, actually quite a bit of research in this area. The scientific principles is really revolve around, what mindfulness is, as well as how mindfulness is a foundation for cultivating compassion. And the first principle is neuroplasticity. Neuroplasticity just means that the brain changes in response to our experience and to our environment. So in other words, if we nurture our brain in a mindful and a compassionate way, the brain actually rewires itself through repetitions, just as when we, for example, if you play golf, right, or if you play the piano, the more repetitions you have, the stronger or the better the skills you have. So mindfulness and compassion can actually be cultivated by rewiring the brain. So that's the first principle. The second principle is epigenetics. Epigenetics just simply means that gene expression is influenced by our experience in life. So for example, if we deliberately or diligently cultivate compassion and mindfulness, that can actually lead to epigenetic changes. A good example will be like, for example, the oxytocin gene for compassion can actually be induced to express more if we cultivate compassion. Or,
Oh, wow.
yeah, that's
Yeah,
really
that's
fascinating area, right?
that's amazing. Yeah.
Even more fascinating is that with mindfulness, there have been many research that show that the age or the telomeres, which is responsible for aging, can actually, the expression of the telomerase genes can actually be changed through mindfulness and compassionate practice. So in other words, there's been research showing that with mindfulness and compassion training or practice, it can actually increase our lifespan. So that's really, really
Oh,
interesting.
wow. That's
And
amazing.
then,
So can the opposite happen, Agnes? Can the opposite if you're not, repeating bad behaviors and things along the lines of epigenetics, is something similar happening?
that is an interesting question. Now, I don't know the answer to
Oh,
this. I don't know the answer to this, but at least we know that, through epigenetics, we can lead to a kind of longer lifespan.
that's amazing.
And then the third principle is about inborn goodness. Basically, it's about that, when we are born, we're first born, we're actually born with a prosociality, that we are predisposed to prosocial behaviors. In fact, a study in Nature showed very, interestingly, that in these young babies, that, they actually prefer characters or puppets that show more prosocial behaviors. So in other words, our innate capacity for compassion and kindness is already there. It's just when, we're exposed to different kind of social conditionings and social, education, that we start to discriminate against people or become fearful or become, unfriendly to people who we consider as not belonging to our tribe. The underlying kindness and compassion is already there. So our job is really how to decondition ourselves, unbias ourselves, so that we can allow this innate goodness to be revealed again.
Wow. Very interesting, Agnes. Thank you.
So I'm going to get into a little bit more practical mindfulness. Do you want to tell us about the three major forms of mental or mindfulness training? So what I read about was these three. So focused attention, open awareness, and loving kindness and compassion. So do you want to describe those a little bit to us? And then I have a follow-up question after that.
Sure. You hit it right on. In a secular practice, or common popular practice, there are three components of mindfulness or mental training. The first is focused attention. Focused attention simply is a practice that allows us to pay attention on a certain subject or a certain object. So, for example, when you think about meditation, most of us will start thinking about, it's about focusing on the breath. So this is one example of focusing on an object. So we can use our breath as an object. Sometimes you can actually use, a bodily sensations of object of focus. The whole idea for this practice is really to train our attention, which is really critical because, if you think about it, in our daily life, we're bombarded with all kinds of distractions, right? Text, emails, entertainment, etc. So this focused attention practice allows us to develop attention stability, so that we can live more life fully. A second practice is called open awareness, which is kind of like a step, kind of a little bit more advanced in the focused attention, because the focused attention allow us to stay focused, right? Which then lead us to this practice called open awareness, in which we let go of focusing on the object, but instead allowed our attention to focus on whatever that comes to our mind. So it could be a thought, it could be an emotion. And the beauty or the magic of this open awareness practice is that as you realize these thoughts and emotions, then you start to notice that thoughts and emotions kind of like they come and then they stay a while and then they go. Just like clouds in the sky, sometimes they're big clouds, small clouds, dark clouds, white clouds, but the sky is always there. So you can have a taste or glimpse of what our mind actually is underneath the clouds, underneath the distraction, underneath the thoughts. It's always this big blue sky that's always shining. So with practice, we'll be able to develop a sense of peace, and also a sense of joy because we're able to be with the big sky, that's always there in our mind. The third practice, as you mentioned, is loving kindness and compassion, which is a practice that we focus on sending well wishes for all beings to be happy and to be free from suffering. So in other words, we send kindness, we send our concern for others, wishing them happy and to be free from stress and anxiety. So these are the three forms of mental training that is commonly practiced, in mental training.
That's great. Thank you, Agnes. I'm feeling calmer just listening to you speak about these things. So my follow-up question for you is, so I know you've been involved in this now for a few years, and I remember hearing about you starting to teach these things to our broader community. I want to know, it's a bit more of a personal question, but answer it however you feel comfortable. How did you get started? What did your mindfulness practice look like when you were just a beginner, and how has it changed over this length of time where you've gained more knowledge and experience?
So I would say at the beginning of my practice, I was just a chance encounter with a book, which I was about, to recommend is actually a book by Professor Mark Williams. It's called Mindfulness and 8-Week Plan for Finding Peace in a Frantic World. So basically this book, explain what mindfulness is, as well as have some of the guided practice in the form of MP3. And what is most interesting in the beginning is that, of course, I find that most people do find that the mind is just wandering all the time. It just won't settle, right? But then the amazing thing is, as the 8-week progresses, I start to notice that my mind become a little bit calmer. I'm a little bit more able to focus my attention, as well as really having a little bit more peace. And also it changes my interactions and relationships with people around me. So after the 8-week practice, I decided, I'll continue this for the rest of my life. So how it changes over time is, at the beginning, especially if you are considering, starting a practice on your own. So guided practice is very, very useful, very helpful. And also start slow, small chunk. So, even do 5-10 minutes a day, just do it every day or 3 days a week. Just find something have a plan that is doable, right? So 5-10 minutes a day, for few times a week will be really, really helpful. And then as you progresses, at least in my experience, that I start to really see that my mind become more clear, my relationships become better, as well as become less reactive to the little things around me. Then I naturally, migrate to, do a little bit more each day and become, a daily practice. So I think, of course, everyone is different. So you have to find your own pace and what works for you. But I would say that the most important thing, and I think for type A personality, like most of us, right, having the diligence is not that difficult as long as we can see the benefit. So I would say stay at it, and then you will start to kind of notice that things start to change. And as you change, people around you also start to change. So that is a really, really interesting aspect of it.
I love that. Thank you.
Excellent. Well, it sounds like even with your kind of change of plans, you're still as busy as you were before. So, at this point, Agnes, we'd like to ask our guests how they spend their free time. Do you have any favorite books or podcasts to share with our listeners? And I guess more importantly, how do you find your own mindfulness space? What do you do in terms of that?
Well, that's a really interesting question. How do I spend my free time, right? Okay. I actually, I think this is very important, is that free time has to be deliberately, you have to kind of find your own free time. Free time doesn't just happen. So having that kind of intention to set some time as free time is very important. So how I spend my free time, mostly, reading. I also really enjoy walking outside, a lot now these days. In the past, when I was busy, never really have time to go to nature, or even to walk in my neighborhood. So spend a lot of time there is kind of part of my practice. And I mentioned that I also like to read a lot of books, and some books that really kind of changed my life. For example, John Kabat-Zinn, who I mentioned earlier, who is really kind of the father of Western mindfulness, who brought mindfulness into the West. One of his books that really captured me is Wherever You Go, There You Are. Another book that I will highly, highly recommend is a book by Dr. Ron Epstein called Attending Mindfulness, Medicine, and Humanity. This is a book that talks about mindfulness and attention and being present, how is it relevant as a doctor, with all kinds of fascinating anecdotes as well as scientific information. In fact, I use this book I call it a monthly book chapter club. So basically what we do is, with my residents and fellows at Sick Kids, we actually spend each month reading one chapter, because everybody's busy. We don't have time to read a whole book, right? So we just read one chapter a month, and then we get together for an hour to discuss, some of the observations and some of the thoughts that got elicited while reading that chapter. So that's a book that I highly recommend.
Awesome.
Now, in terms of my mindfulness space, I would say, sometimes people have this idea that mindfulness is just about, sitting on the cushions, right? Sitting on a cushion and meditate. But actually, what mindfulness is really about bringing that quality of presence, that quality of clarity into your daily life. So it slowly become like a way of living. So in the, what I aspire to be, or what I try to do, is to bring that quality into every minute of my life, so that my mindfulness space become like my whole life. But of course, it is easier said than done, but this is at least what I aspire to do.
Awesome. Yeah, it's almost like an active mindfulness that has repercussions right off the bat, right?
Absolutely. Absolutely.
Agnes, thank you so much for joining us. I think this was such a wonderful conversation. I really enjoyed learning more about this from you. And I know you have in the past held workshops through the COS on mindfulness. I hope there are more of those to come. And we really appreciate you taking the time this evening to share your knowledge.
Thank you, Saturday. And thank you, Guillermo.
Thank you so much. It's been great talking to you and seeing you again.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
The EyeCan podcast has been made possible by support from MD Financial Management and Scotiabank, proud financial partners of the Canadian Ophthalmological Society and Canada's Ophthalmologists.
Thank you to the Canadian Ophthalmological Society.
The EyeCan podcast is written and directed by Kim Teitler and produced by John Allaire from Allaire Strategic Works.